Did you know that as men age, their risk for developing an enlarged prostate increases quickly? It's perfectly normal for your prostate to grow as you get older. In fact, 1/3 of men over the age of 50 have prostate troubles, and by the age of 80, nearly 90% of men will have an enlarged prostate. Although an enlarged prostate isn't the same as prostate cancer and doesn't increase your risk of cancer, that doesn't mean BPH is danger-free. As the prostate gets bigger, it can squeeze or even partly block the urethra, which can cause irritating symptoms. Typically urinary problems like a weak urinary stream, leaking or dribbling urine, and frequent or urgent urination. While the actual cause of prostate enlargement is unknown, there are some signs that may indicate an underlying issue. In today's video, we're going to uncover 10 hidden reasons for prostate enlargement that will help you understand your body better and take control of your health. So, without further delay, let's look at these potential triggers for prostate enlargement. Number 1. Too much estrogen in the body. Usually, men have low amounts of estrogen compared to women, except for 2 exceptions: in utero, before birth, and when they get older. The vast majority of estrogen in men comes from their testosterone, which converts into estrogen through an enzyme called aromatase. The testes produce around 20% of a man's estrogen, while the remaining 80% comes from other organs and tissues in the body, like the brain, bones, fat cells, and skin. This excess estrogen amount can interact with receptors in the prostate and stimulate its growth, potentially leading to an enlarged prostate or even increasing the risk of prostate cancer. Some common signs of high estrogen in men include enlarged breasts, decreased sex drive, loss of energy, erectile dysfunction, moodiness, fatigue, and weight gain. If you're experiencing any of these signs, it's vital to consult with your doctor and get your hormone levels checked for proper diagnosis. Number 2. Family history. It's a well-known fact that genetics play a significant role in our overall health, and prostate enlargement is no exception. Recent studies have shown that men with a family history of BPH are more likely to develop this condition. This could be due to inherited traits, shared environmental factors, or a combination of both. If any of your blood relatives, especially your father or brother, have had prostate problems or abnormalities in their testicles, it's crucial to monitor your prostate health regularly and be aware of any potential warning signs. It's always good to educate yourself about your health and know about your family's medical history. This way, you can discuss with your doctor what your risk is and how you can implement preventive measures to keep your prostate healthy. Number 3. Lack of physical exercise. It is surprising, but a lethargic lifestyle can have a severe impact on your prostate health. Various studies have shown that lack of physical exercise can enormously increase the risk of developing BPH. This is because when you don't engage in regular physical activity, your body's metabolism slows down, leading to weight gain and decreased hormone production. As we said earlier, hormones play a crucial role in prostate health, and any disturbance in their levels can contribute to the development of an enlarged prostate. If you're not currently active, it's never too late to start. You don't have to run a marathon or lift heavy weights. Even a brisk walk for 30 minutes a day can make a major difference in your overall health. You can also try incorporating activities like swimming, cycling, or yoga into your routine, as they are known to improve blood circulation and alleviate stress, both of which can have a positive effect on prostate health. Number 4. The ethnic background. Now, it may seem unrelated, but recent studies have shown a possible link between ethnicity and prostate enlargement. While age is the most significant risk factor for developing an enlarged prostate, it's interesting to note that certain ethnicities may have a higher risk of BPH than others. According to research, Black and Hispanic men are more likely to experience symptoms of an enlarged prostate compared to white men. Apparently, the reason behind this could be due to a combination of genetic differences and higher rates of metabolic diseases in these ethnic groups. It is also important to note that these findings are not meant to cause alarm or create any stereotypes, but rather raise awareness and encourage men of all backgrounds to prioritize their prostate health. Number 5. People with diabetes. If a man has diabetes, then he would have an increased risk of developing BPH or an enlarged prostate gland. In fact, having diabetes is a significant factor in the development of BPH. A recent study has shown that men with type 2 diabetes, especially those with high glucose levels, are at a higher risk for developing benign prostatic hyperplasia. This is due to elevated insulin levels and changes in insulin-like growth factors, which are known to contribute to prostate cell growth. It can also cause damage to nerve cells and blood vessels in the prostate, leading to inflammation and enlargement. If you have diabetes, it's crucial to monitor your prostate health and communicate any changes or symptoms to your doctor, because early detection is a key to successful treatment. Number 6. Obesity. The higher the body mass index of a man, the greater is his waistline circumference. With a greater waistline circumference, there's a higher risk of developing an enlarged prostate or BPH. Obesity happens to be a leading cause of diabetes, in addition to high cholesterol and high blood pressure, all of which have been linked to an increased risk of BPH. Furthermore, excess body fat can also lead to other serious health conditions such as cardiovascular diseases, sleep apnea, and certain types of cancer, including gallbladder cancer. This excess body fat, particularly visceral fat, can produce hormones and inflammatory substances that may contribute to the growth of prostate cells. So, if you don't want to become a house of diseases, it's important to maintain a healthy weight and keep your body fat percentage in check. Number 7. Heart disease. Having heart diseases won't develop the risk of BPH or enlarged prostate. However, the same risks contributing to heart issues also increase the growth of the prostate. These include obesity, high blood pressure, and diabetes. As we said earlier, these diseases are primary risk factors for an enlarged prostate, and if not properly managed, they can lead to other serious health complications. Therefore, it's essential to prioritize your overall health and take measures to prevent these conditions before they occur. Number 8. Unhealthy diet. You have probably heard the phrase, "What you eat is what you are." Well, when it comes to prostate health, your diet can play an influential role. Just like any other part of our body, the prostate needs proper nutrition to function correctly and stay healthy. However, when you indulge in a diet filled with unhealthy fats, sugar, and processed foods, you are unknowingly increasing your risk of developing an enlarged prostate. Also, drinking excessive amounts of alcohol or caffeine can irritate the prostate and cause inflammation. So, stay away from those unhealthy foods and drinks and instead incorporate more fruits, vegetables, and lean proteins into your diet to support a healthy prostate. Number 9. Inflammation. A majority of observational studies suggest a strong link between inflammation and the development of an enlarged prostate. This could be due to systemic inflammation caused by conditions like metabolic syndrome, which promotes oxidative stress in the body. Inflammation has been linked to both prostate enlargement and cancer, making it an essential factor to consider for your overall prostate health. Studies show that men with more severe inflammation have higher IPSS scores and are more likely to have LUTs. It's also worth noting that infections such as gonorrhea and prostatitis can increase the risk of BPH surgery and LUTs, so proper treatment and prevention of these infections is crucial. Number 10. Erectile dysfunction. While erectile dysfunction does not directly cause an increased risk of developing BPH, it is common for both conditions to co-occur. This is because BPH treatment can sometimes worsen erection problems due to the use of medications like tamsulosin or finasteride. These medications are intended to treat the symptoms of an enlarged prostate, but they can have side effects on sexual function. However, it's important not to ignore either condition, as they can both impact a man's quality of life and should be discussed with a healthcare professional for proper management. Preventing BPH risks such as genetic factors, age, and race isn't evidently possible. However, the other risks for an enlarged prostate that we have discussed are entirely preventable. By living a healthy lifestyle, maintaining a balanced diet, managing chronic conditions like diabetes and high blood pressure, and getting regular checkups with your doctor, you can significantly reduce your risk of developing an enlarged prostate. With early detection and proper management, the symptoms of BPH can be effectively controlled, and you can continue to live a healthy, happy, and fulfilled life. We truly hope this video has given you a better understanding of the various factors that can contribute to an enlarged prostate and how you can take control of your prostate health. If you find this video valuable, please give it a thumbs up and subscribe to our channel for more informative content. Until next time, stay healthy and stay informed.